Okay, so we're here with Mark Clark, and Mark had PRP. When was it? About
October 1st.
October 1st, and that was in your left knee, and you had a pretty bad-looking MRI scan. You had a total thickness tear of your medial meniscus and some other fraying. Is that right? Pretty bad knee.
Pretty bad.
And you've been suffering with pain for how long?
Probably 8 to 12 weeks before that.
And then we did PRP, and how quickly did you have pain relief?
I didn't have any pain immediately following the PRP procedure for about 5.5 to 6 weeks until I didn't follow the doctor's orders and climbed some stairs.
So stair climbing was bad?
Stair climbing was bad.
Just like the doctor predicted?
Just like the doctor predicted.
And had you not climbed those stairs?
I wouldn't have had any pain, and still don't have any pain.
So you're pain-free the majority of the time now?
I'm pain-free. I was sore for a couple days after the stair climbing, but other than that, I've been
But that got better?
It got better.
And the PRP procedure was pretty easy?
It's pretty easy. You know, it's like a bee sting. Once the sting is there and it's over with, it's very, you can deal with it.
But you walked out of here?
Walked out.
And you were how the next day?
Pain-free.
Didn't really know you had anything done?
No, just the swelling in my knee existed, and that was obviously noticeable.
That was there prior to the shot?
That was there prior to the shot, and with the PRP in the knee, it was a little more difficult to bend it, but there was zero pain.
So would you feel that your bad knee injury, your meniscus injury, your torn meniscus has been healed by the PRP?
I believe it has.
So platelet-rich plasma therapy is what would you say is what kind of option compared to surgery?
#1 option. There is no #2.
That's great. And so now you're able to pretty much resume your activities, and you're going to get back into some light working out.
According to doctor's orders, light exercise.
Great.
Tomorrow morning.
Tomorrow morning. And then golf, and still stay off the stairs, right?
I'll stay off the stairs.
You probably want to do that for 8 to 12 weeks.
That'll be good.
Great. One other question, Mark. I want to ask you, how much downtime did you have from the PRP?
0.
Did you have any rehab?
0.
So you had the shot, and then the next day
I had the shot. I walked out of here the day of the shot.
You walked out of here.
I walked out of here with no ace bandage, no support.
Band-aid. You had a Band-Aid on
I
it.
had a little Band-Aid on it, which I showed to 10 people after I left here, and no one could believe it. The next day, I got out of bed with no pain, no help, and walked. And I continued that way, never had any assistance walking.
So you missed 0 time. Your work full time.
My downtime was 0, and I did not miss any work. Didn't miss any family activities.
Did you have to go for rehab or anything?
I have not gone for any rehab.
So you had a total thickness tear of your left meniscus with a lot of effusion and some fibers and other bad things on your MRI scan. You came in here, you got a platelet-rich plasma injection in your left knee. You walked out of here. Next morning you got up and you had no pain, and you went back to work.
I had no pain, went back to work. My wife couldn't believe it.
No physical therapy, no rehab.
Physical therapy.
Wow.
Followed the doctor's orders, and I was good to go.
And you were going to have knee surgery.
I was scheduled for orthopedic surgery the following Monday.
And how much rehab did they tell you were going to have?
I believe they told me I was going to have at least 2 weeks of serious rehab after 2 weeks of being completely off my feet, then 2 weeks of serious rehab, and then another 4 weeks after that of continuous light rehab. So,
and how much work would you have missed?
A lot. I am fortunate I have a desk job, but I still would have missed a lot of work.
So, even though PRP isn't covered by insurance, the PRP procedure saved you not only a lot of pain and suffering, but it also didn't compromise your work status. Is that right?
If I could get the return on investment for the money I spent on the shot in the stock market, I would have no problem having clients lined up outside my door begging me to invest their money. In my opinion, it was completely priceless, worth every penny.
Do it again?
Well, I hope I don't have to do it again, but would I do it again? Absolutely. If I had a similar injury, I'd do it again without thinking about it.
Great. Well, I'm glad you've done so well. Thank you again.
Thank you.